from the Early Learning Coalition of Flagler and Volusia. Today we are going to talk about dental hygiene and really about oral hygiene. It is very important to take care of your children's teeth and to show them how to take care of their teeth because it impacts so many areas of development. For instance, if your child is missing teeth due to cavities, it can impact their speech, which is the articulation portion of communication. It can impact their nutrition. They may not be able to eat certain food, which in turn can impact how they are growing, their physical health. It may impact their mood because when you have cavities, it is painful, and when you're in pain, you're cranky. It also impacts their learning. Again, when you are in pain, you are unable to focus on what is said and what you're supposed to be learning because your body is focused on the pain. So what is a cavity? A cavity is a bacteria that comes into contact of sugar and starch in your mouth and then attacks your teeth. Milk and juice have sugar in it, and therefore the Center for Disease Control and the Dental Association, the American Dental Association, strongly recommend not to put babies to sleep with a bottle, and also not to allow your toddlers to carry a sippy cup filled with juice throughout the day. When your toddler is thirsty, again, they can ask, or you can offer on a regular basis, but avoid to have a bottle or a sippy cup accessible throughout the day. Also, laying down your baby with a bottle is a choking hazard, so you want to make sure that you hold your baby when you're feeding them. They also recommend that you wipe your baby's gum after each feeding, again because milk has hidden sugars. So putting your baby to sleep with a bottle can cause baby bottle tooth decays, and also not wiping their gum after each feeding can lead to baby bottle tooth decay. And this is just an example of what baby bottle tooth decay can look like. So we strongly encourage you again to use a washcloth, or there are also some little baby toothbrush that you can use with your baby. This would be for an older baby. Again, for your younger one, use a clean spit cloth or a washcloth. For your toddlers, you can start to introduce toothbrush about 18 months of age. Again, there are many types of toothbrush available. Choose one that you feel is the best for your child. You want to make sure that it has a shape or something in place so that your child does not gag and push towards the throat. So you have many options. It is important that you do not introduce toothpaste until age 2. This is what the American Dentistry Association suggests, and that once you introduce toothpaste, that is it's the size of a grain of rice, no more. I also would suggest for you to read the ingredients in toothpaste and make your choice accordingly. Like any skills, brushing teeth needs to be taught. You need to show your child, you need to help your child, you need to demonstrate and practice together. It is a nice opportunity to have some mommy me time or big brother, little brother time so that they can practice and show. A personal story, I did not know that I needed to brush my tongue and my palate until a dentist came to school and made a demonstration demonstration. So it is important that you demonstrate to your child how to brush teeth. You can face each other, you can look at each other in a mirror, and also you can brush your child's teeth to show him where he needs to go and what he needs to do. So to brush teeth, again, you want to use some gentle circular motions, and you want to brush all the sides of the teeth inside as well. You want to brush the gum, you want to brush the palate, and as I mentioned, the tongue. And you would do the same thing at the bottom. You can use props like this, but again, you brushing teeth with your child is going to be much more effective. There are also books available that you can lend at the library. It would be also helpful to visit a dentist without any reason, just for the purpose of visiting and introducing your child to dentistry. So that your child is familiar with a dentist office. The dentist can also show how to brush teeth, and so that if you ever need to go to the dentist for cavity purposes or other purposes, your child may not be as anxious.